Hi, this is Jay. Welcome to Bright Ideas.
The provision of an early intervention program to children with developmental delays or disabilities has gained wide acceptance in the past decades. The child with mental retardation benefits from an early intervention program. The skills that are normally learned during early childhood are taught at a time when the child is still young and more malleable than when he or she would have grown older and less flexible. The opportunities to learn the adaptive skills early are enhanced and increase the chances for the child to be able to cope with the demands of future environments. Here are the four models of early intervention: home-based instruction program, Head Start program, community-based rehabilitation or CBR services, and urban basic service program. Number one is home-based instruction program. The Philippine Association for the Retarded, or PAR, composed of special education specialists, parents, and medical practitioners, initiated the development of the home-based instruction program for children with mental retardation in the 1970s. The goal is to provide a continuous program of instruction both in school and at home for a more effective management of handicapping condition. The program utilizes the Filipino adaptation of the Port Age project. The Port Age Guide to Early Intervention is printed in Filipino and the dialect of some regions. The National Capital Region and Region 5 are implementing the program. Davao has also implemented the project. The key persons are the biological or surrogate parents who perform their primary role as caregivers. All members of the family, including the household helpers, are trained to implement the program. Monitoring and evaluation of the program show positive results. Number two is Head Start program. The Head Start program in Manila City Schools Division addresses preschool education for the socially and economically deprived children who are 4 to 6 years old. The program operates on the principle of early intervention as a preventive measure against behavior problems among young children that may lead ultimately to juvenile delinquency. The participants are children and siblings of youth offenders, slum dwellers, street children, and others of preschool age. The Head Start program was subsequently adopted by the Special Education Centers of Manila with a group of parents serving as teacher aides. Number three is community-based rehabilitation or CBR services. The World Health Organization or WHO in 1984 defines community-based rehabilitation as measures taken at the community level that use and build on the resources of the community to assist in the rehabilitation of those who need assistance, including the disabled and handicapped persons, their families, and their community as a whole. The community-based rehabilitation has been acclaimed as the answer to the rehabilitation needs in poverty-stricken areas where institution-based rehabilitation programs are not available. Piloted by the National Commission for the Welfare of Disabled Persons or NCWPD in Bacolod and eventually expanded to selected communities in Luzon, Visayas, and Mindanao. CBR services have been successfully organized in many communities for preschool and school-age children and young adults. The utilization of the services of volunteers is employed and maximized in providing rehabilitation programs to urban and rural communities. Number four is Urban Basic Service Program. An early intervention scheme based on the principle of home-based instruction was adopted by the Urban Basic Service Program as its education component. The program also utilized the Filipino adaptation of the Port Age Guide to Early Intervention. 12 barangays or villages identified as depressed and underserved were chosen as sites for the program. Children with disabilities who are not receiving special education services were placed in the program. 20 to 30 parents were trained yearly to implement early intervention at home as a means of minimizing the effects of the disabilities and increasing the children's readiness and response to rehabilitation programs. There are at least 5 reasons why early intervention program services should be provided. First, during intervention, secondary disabilities that would have gone unnoticed can be observed. Second, early intervention services can prevent the occurrence of secondary disabilities. Third, early intervention services lessen the chances for placement in a residential school since a child with the basic self-care and daily living skills has a good chance of qualifying for placement in a special education program and regular school. Fourth, as a family gains information about the disability, the members learn how to offer support and fulfill the child's need for acceptance, love, and belongingness, very much like the ways they behave towards the normal children in the family. And lastly, early intervention services hasten the child's acquisition of the desirable learning and behavior characteristics for the attainment of his or her potential despite the presence of disability.